Every minute counts when a stroke occurs, and we are spreading awareness this month on how to be aware of the signs and symptoms. Craig Miller and Dr. Nick Kleesner, emergency room physician of Unity Point Health, are here to talk about this. As we said, May is Stroke Awareness Month, and Craig, you know all too well about stroke. You are a survivor.
I am.
Tell us about what you experienced.
I would be the last person to say that that's what actually happened to me, except that I know that from the doctors. It was a normal day. It was Sunday. I was dressed, ready to go to church, and my wife had just gone upstairs to change, and I was watching TV, and there was a preacher on, and happened to notice the captioning. And in my mind, the captioning didn't match at all what he was saying. I didn't know why it was that way. Obviously, it was a mistake with the television production. It wasn't me not contemplating, what that meant. And when she came downstairs, I tried to explain it to her, and the words just didn't come out.
And so you were life-flighted to Iowa Methodist. What was that like? Do you remember much of that day at that time?
I do. Actually, by then they had administered the TNK. I didn't really get that at the time. The doctor explained it to my wife, and he basically said, "You're going to make the decision on this," because he realized that I wasn't in a position to make that. And a lot changed in just a few minutes. It was very miraculous what happened within the administration of that drug.
And Dr. Kleesner, what is TNK? What is that medication?
Yeah, it's an abbreviation for tenecteplase. It's an IV medication that we use to dissolve clots, essentially. And in Craig's case, the clots in the brain causing a stroke.
And we keep hearing the term fast. Do we need to get to the emergency room like he did very fast to get that medication for it to work?
Yeah, absolutely. Basically, we can only give it within the first few hours of a stroke starting. So sometimes we can push it out to 4.5 hours from the onset of the symptoms. So in Craig's case, he was very fortunate that his wife identified the subtle symptoms he was having so we could get him the treatment in time.
Yeah, you mentioned subtle symptoms because you didn't even think anything was wrong. You thought the TV was wrong. What are other symptoms and signs we should be looking for? Yeah,
so probably the best way to remember it is an acronym. BFAST is kind of the acronym that we push out during Stroke Awareness Month, which stands for balance, so troubles with coordination. Eyes, or difficulty with vision. F is for face, like facial drooping. A is arms, it's like clumsiness. And then in Craig's case, S is for speech issues. And the T just stands for time, that you need to, if you identify those problems, come in and see us right away.
And Craig, how are you doing now? You seem to be doing really well.
I really am. It was mild, it was caught early, so it's hard to say that, yes, I'm a stroke survivor, because I've seen folks in much, much worse condition, and this just didn't happen that way. It was mild. It was a little bit of strange feeling, and not much else.
And we're seeing some pictures of you in the hospital. Is that right away, even after you had this medication?
That was probably the first day after. That was probably the day that I was released. I came in on a Sunday and I left on a Tuesday afternoon.
And Dr. Kleesner, you probably don't see that all the time, that outcome.
Not all the time. Yeah, that's right. But in Craig's case, when you identify it early and we can get the treatment in time and we can get you where you need to be, then you can have a good outcome.
So that's the big takeaway. Be fast, and you can get us that medication and save a life. Thank you both so much for being here. Thank you for sharing your story.
Appreciate it.
Well, remember, be fast. To learn more about Unity Point, visit unitypoint.org. You can also follow them on social media.